Hi, my name is Andrianna Stevens, and I'm a recent graduate of Hiram College. I'm a peer mentor in the Science Internship Program, and this summer my mentor, Dr. Mays, and I in the Emergency Department worked on the project Clinical, Demographic, Emergency Department, and Hospital Factors Affecting Length of Stay in the Emergency Department. Little research has been completed to determine factors affecting emergency department or ED length of stay. And research that has been conducted has focused on single factors affecting length of stay, such as overcrowding or how length of stay affects patient care. The purpose of this study is to determine the demographic, clinical, and hospital factors affecting length of stay in the ED at the Cleveland Clinic. A retrospective chart review was conducted using ED charts at the Cleveland Clinic for July 19, 2009. Data collected included demographics, ED procedures, lab studies, radiology studies, consultation, social history, medication, times, and total length of stay. Approximately 151 patients out of 158 patients' data were analyzed. The data were analyzed using SPSS. Data collection and SPS analysis is ongoing. The population that comes into the ED is 56.3% female and 43.7% male, and predominantly adults aged 22 to 64, and our population also includes individuals of pediatrics and geriatrics. The ethnicity in the emergency department is 58.3% African American and 36.4% Caucasian, and those are the predominant races. Our patients mostly arrive by walking in, 83.4% do, or the EMS at 9.9%. 70.9% have insurance, 27.2% have no insurance. Most of our patients have urgent or semi-urgent needs and have a medical diagnosis, the most common complaints being pain, urological and gynecological issues, mild trauma, or respiratory issues. 51% of our patients receive labs, the most common ED labs being a urinalysis or a urine pregnancy test. Our most common main hospital labs are a complete blood count or a basic metabolic panel. 73.5% of our patients receive medication, the most common medications being pain meds or antiemetics. 21.2% receive greater than 3 medications. 42.4% receive radiology, and the most common type of radiology is a plain film X-ray. The most common ED procedures are receiving an IV or an EKG. Most patients are seen by an attending physician and a resident. Depending on the diagnosis, a patient may receive a specialized consult or a social work consult. Our average length of stay is 5 hours, the minimum length of stay being 1 hour in a pharyngitis case, and the maximum length of stay being 22 hours in a psychotic episode case. Our statistics have shown that the total number of medications given in the ED correlated positively with length of stay at the 0.05 significance level, meaning the more medications you receive, the longer your length of stay will be. It was also found that receiving specialized consultations also correlated positively with length of stay at the 0.01 significance level, meaning receiving a specialized consultation increases length of stay. It is predicted that hospital factors such as diversions, staff, or beds available will also affect length of stay. However, clinical diagnosis is predicted to be the most important factor affecting length of stay in the emergency department because it provides a map of all the procedures, consult, medications, and etc. you will receive during your stay. In the future, data will be compiled and analyzed for 1 full week in July 2009 and 1 full week in July 2010. Data from additional times of the year will also be collected and compared. Hospital factors will be added into the analysis. A focus on what factors influence mental health patients' length of stay in the ED will also be presented. Upon completion of the research, suggestions to the ED administration will be made to improve length of stay. I would like to thank Dr. Sharon Mays, Dr. Pittman Gay, the Cleveland Clinic, and the Office of Civic Education Initiatives, Rainey Webster Committee, and Dr. Hills and Dr. Lamb.